the last segment, we talked about healthy French fries, but what about healthy potato chips? Is there any such thing? In today's healthy shopping segment, we're going to show you how you can pick good potato chips.
Well, Shirley, you know, when we were off air, we were talking with Dr. McKeever for a minute, and he said, you know what, the French fry guys are going to figure it out.
That's true.
Like you said, some of them eliminated the trans fats and now they taste bad. Well, they're going to figure it out because there's profit in it.
That's right.
And that's the beautiful thing about free enterprise zones in this country. And such as it goes with potato chips. Yeah. Potato chips are always known as a junk food, and with good reason, but until recently. You can now go into a store, and this is the potato chips we buy for our kids. So if you're a fly on the wall with a microphone reporting to the rest of the world what the Costello family lives like, you would say, that guy is such a hypocrite. They eat potato chips, they eat cookies, the guy's having French fries.
He puts chocolate in his pancakes. Yeah,
hot dogs. I mean, the guy's just a hypocrite. But you can, but again, it's not what the food's called, it's how you buy it. So you can go now, in fact, even the mainstream stores have them, and buy potato chips, and this is what they are. Again, a quick tip here, when you're reading a label, the less that comes after the word ingredients, the better.
Yes.
The more lines, the worse it is, and that's not rocket science. Even I can understand that, okay? In the case of potato chips, the ones that we buy, they're organic potatoes, expeller pressed oil, which means cold oils, you know, like canola, so it's not the recooked oils, and spices. Might be paprika, salt, whatever it is to spice that potato. That's it.
Are you allowed to give some brands?
And they're...
Are we allowed to give brands on the show?
I'm trying to think of the name that we get all the time, but they're also baked.
But because I have had a hard time finding them in the regular grocery store.
Here's what we will do. At Kylia.com, we will have Trevor populate the site with a few different brands.
Oh, that'd be great.
Suggestions.
Yeah.
So you talk about something that's baked, so there's no trans fats.
Oh, they're baked.
They're baked.
Well, now are they any good?
They're delicious. It's funny because if I eat the other kind for whatever reason, like if I go to a Cubs game, I'm having one of those really, really bad hot dogs and some of those chips because I can't do a Cubs game without it, okay? I'll repent before, I'll repent after, I'll run 2 extra miles on a treadmill, but I'm having a hot dog at the Cubs game, and nobody's going to take that away from me. So if I do taste those other chips, it's like, oh, I can't believe I used to
Really? So, but you get used to the baked ones.
It's a matter of this is what it's supposed to taste like. This tastes like a flavored potato. So that's how you buy healthy potato chips. Maybe you're going to share some of the stuff with your patients, you know, that they can
Actually,
have.
You need to think about writing these down and publishing them.
Did you know you could eat book? Yeah. Did you
it's
know
a
you could eat book?
Great idea, Joe.
Yeah.
Great idea.
What do we got next here?
Well, you were going to ask, you had a couple more questions for Dr. McKeever.
We do. One was we left off on the last segment talking about the angiogram and angioplasty, and you talked about the differences of what the two were. And off air, I asked you, and I'd like our viewers to hear it, is so if you're having the angiogram, and it turns out you need additional intervention, either the balloon and or the stent with the drugs, is all that kind of hooked on like fishing lures on a fishing line so you can activate it at any time?
Yeah, you can go right ahead and do whatever you need to do to treat the patient after you've taken the angiogram. It's all done through kind of similar means. So a catheter is placed in the heart, and then through that catheter goes the balloon and the stent.
Wow.
So it just stays there if you don't need it.
Yeah.
So you have like a button to blow it up. It's kind of like a PlayStation thing where
not quite like that,
joystick
Joe,
where it's time to open up the balloon.
You know, it really is truly amazing, though, the advancements in medical treatments, and that is why our age expectancy, our life expectancy is increasing.
That's exactly right. You know, I've been in this 30 years, and I've been blessed to see all of this technology from the time before we had it till now. And it's really remarkable. When I came out into practice and we had a patient with a heart attack, we'd give them morphine, put them to bed, and hope they were alive in the morning because there was absolutely nothing else we could do.
That's amazing.
Now we're at the bedside stopping the heart attack in midstream.
Can I ask a viewer question?
Please.
Because I think these are very important questions. And one is, what about having sex after a heart attack?
Sex is, you know, an important part of our lives, and so what you need to know is it safe to exercise in the way that you exercise with sex? Because it's just like going on the treadmill. It's just a different form of exercise. So all of our patients, after an event like a heart attack, we do physiologic stress tests on them to see, is it safe for them to exercise? And from that, we can tell whether or not having sex is going to be dangerous. And the things that we worry about are rhythm disturbances arising from the sex. But by and large, it can be, patients get back to normal lifestyle, and including sex, and that's our job, to try to get you back to normal.
You sometimes have to tell people, though, you can exercise, but you can't do that?
I don't remember ever doing that. If you can exercise, you should be able to have sex.
Well, I was going to say, and sometimes after you've had an event like that, they prescribe exercise for you, maybe walking, and then building it up gradually to walk faster and so on.
So I've got to ask you, Doc, when you have done things like angiograms, and that even is becoming a specialty within itself. I mean, years ago, cardiologists, you kind of do all these things. Now, correct me if I'm wrong, you have docs that specialize in the angiograms and that type of intervention, right?
Right. That's what I am. We're called interventional cardiologists. Then there's other cardiologists that are non-invasive, and they read all the echoes and the nuclear tests. There's electrophysiologists. I'm a plumber, and the electrophysiologist is the electrician. So he deals with the electrical events of the heart.
Things like that.
Rhythms.
But what's some of the most disgusting thing you've ever seen inside somebody's artery? I just got to ask. I mean, how bad can it get? I want it to be an incentive to our viewers to never get there.
We're not talking about a colon here. We're talking about an artery here.
But you can get some pretty clogged up, mucky stuff, right?
Pretty bad stuff.
You ever see a cheeseburger in somebody's artery?
Now remember, we look at it's a black and white image.
Okay.
It's
either flowing or it ain't.
Yeah.
Okay, all right. Well, I think with that we'll go to a break. Remember to log on.
Hoping for a cheeseburger in the artery.
Remember to log on to Kylia.com for more information. And coming up, we're going to be answering some more of your questions. And you can email us at balancedhealth@tln.com, and we'll be right back to answer some of those questions that you've already sent in. So stay with us.